Prime Minister Modi wrote to President Xi Jinping and offered assistance from India. But how can India help China at this point? Should India help China? What about India's own preparedness? Our next report has all the details.
As China battles the deadly coronavirus outbreak, India has offered help. In a letter to President Xi Jinping, India's Prime Minister Narendra Modi says Delhi is ready to provide assistance. He also appreciated the cooperation of the Chinese authorities for the evacuation of more than 600 Indians from Wuhan. Beijing responded with a word of thanks. While the specific contents of the letter have not been made public, India is already working to ease China's coronavirus pain. India has lifted a ban on the export of personal protection equipment like surgical masks, meaning Indian manufacturers can begin shipping to China that urgently needs these supplies.
We have one of the world's largest national disaster response force. That is one which has already done very good work. We also have the Institute of Virology. We have skill sets in vaccinations. So we have our strengths, and this is a global emergency. So everybody who can contribute or who can assist China in this hour of need, I guess, is willing to offer the assistance.
Experts believe that the coronavirus might also test India's own healthcare system.
We have to recognize that even within India, there are areas and states where the health system is weaker than in other states, and therefore we need to really strengthen the capacity of every state in India to be able to handle this or any other such emerging infection in the future.
So far, Indian authorities have made some aggressive moves to tackle the threat. Almost 2 lakh passengers have been screened at 21 Indian airports. More than 9,000 people are under community surveillance across states. Only 3 cases of the coronavirus have been detected in India, but the risk still remains. A study claims that India ranks 17th in a list of countries at risk of coronavirus import. India's weak public healthcare system might not be equipped to handle the crisis that could erupt. On an average, India has just 7 beds per 10,000 people. A spread of the coronavirus in rural India would be hard to contain. There are only 20,000 odd hospitals in rural areas. Some of them lack even the basic facilities. While India supports China as a responsible neighbor, it must pull up its own socks too, mobilize its own resources and share knowledge and know-how to battle what has become a global killer. Bureau Report, WION World is One.